The office towers are still pretty empty, but hundreds of people will come back to work here, and Sal Mantilla is ready.
Let me take you for a tour of our building, HVAC systems, and how we're doing to combat COVID.
Mantilla is operations manager for Choice Properties, and when it comes to filtering the air people share, his job starts here.
Let me show you how air is brought into the building here. This is where air is introduced to the main shaft of the building. As you can see here, the dampers are wide open, allowing for 100% fresh air to come in.
Before that outdoor air goes any further, it passes through a wall of high-grade filters.
First set of filtration is coming through these filters. They are MERV 13 filters.
What does MERV 13 mean?
MERV 13 is a grading of filters. So the higher the MERV rating means that it can capture smaller particles.
The duct tape is an added measure.
Duct tape here actually forces the air to pass through the filter. There's always a bit of leakage.
And why is it so important to do all this?
Well, we want to make sure that we have a safe environment for our tenants to set up shop and work. And it's what we do. This is our business. This is what we take pride in, our buildings. We want to make sure that we are providing safe work environments.
COVID has made clean air more important than ever because the risk of airborne transmission of the virus is now clearer than ever. And we're not talking about someone sneezing or coughing close to you, but from tiny infected particles expelled and inhaled when people are talking, singing, or shouting. Those aerosols can travel in a cloud indoors for longer distances and linger in the air indefinitely. Public health authorities in Canada only recently acknowledged the aerosol risk. The guidance on how to manage it is still emerging, but places acting on the threat didn't wait for it.
Our public health standards talk about good ventilation. So what's good ventilation? How do you actually quantify that from an engineering perspective? So we've relied on the science that's out there.
Ron Saporta is the Chief Operating Officer at the University of Toronto. He started tracking the aerosol research from the start. The university has a mix of century-old and modern buildings. MERV 13 filters were installed and the volume of fresh air increased, especially in high-density spaces like classrooms.
This is one of our buildings at the
airborne risk is higher the longer more people are indoors together.
And I'm going to show you one of our classrooms where we put in one of the air purifiers.
But some spaces are harder to purify through mechanical ventilation. Saporta had portable air cleaners with high-grade HEPA filters installed in those rooms.
So there's a HEPA filter in there. It pulls the air in from the classroom, it filters it at that level, and then it brings it back into the classroom. So what we've decided to do was to set up a specific target for ventilation in our classrooms. And what we've done is we've set it at 6 air changes per hour. So 6 air changes per hour, it's about the ventilation rates you'd see in hospitals and places like clinics.
Clean air is a critical piece, especially as the race between variants and vaccines continues. But it's not clear how many settings are taking ventilation precautions, even among ones that have been operating this whole time. We reached out to several essential workplaces that had numerous past outbreaks. They either declined to speak to us or didn't respond to our inquiries.
Hi, everyone. As people start returning to work, what is it they should be aware of?
Raising awareness is critical, and why a group of aerosol experts has come together.
Cleaning the air will do much more than cleaning and disinfecting everything in sight.
Yeah. Marianne Levitsky is an occupational hygienist, an expert in workplace safety. She says safe air is critical to a safe workplace.
If you look at the major outbreaks that happened in workplaces, we have to ask why. Because we know, at least the employers said, they were implementing the measures that they were being requested to implement, plexiglass barriers, masks, distancing, cleaning, etc. And yet workers were still getting sick. So what was not being implemented? Well, it was probably good ventilation and proper respiratory protection.
And what is your main concern right now?
My main concern is that we're not paying enough attention to the aerosol nature of the virus and the fact that it can be transmitted in the air. So I think ventilation to a great extent has been the missing piece in this discussion.
Sean Stone learned that the hard way.
I think when something impacts you personally and very, very close to you, it hits home.
Let's just have a look at the Rogers
Stone and several of his dozen employees got sick with COVID last spring, despite following all the public health precautions.
And we make sure that the dates are correct. And
his company distributes electronic components. As an essential business, it's been open the whole time.
We don't need or want to wait for the government to do the right thing. And the right thing is to create a healthy, safe environment for our people to come and work. I think the worst thing for somebody would be to be worried about their well-being going to work every day. So we're trying to mitigate that as much as we can.
I'm just going to go and stick the O2 meter outside.
That included connecting with industry advocate Larry Gold,
397 to 398 parts
who is helping small businesses figure out what they can do to mitigate the aerosol risk. Measuring CO2 levels is one way to detect a concentration of unfiltered air.
397, which is minuscule difference.
So is keeping the space well ventilated. The warehouse door stays open most of the time, and the plan is to keep it open regularly, even when the weather gets colder.
So ideally, we do want it to be in the middle of the room. Obviously, because of the different obstacles, we're going to have to play around with it.
And in the office area, where airflow is more limited, Stone invested in 4 portable air cleaners with HEPA filters.
We got one in this area, one in there. We got one in this room here.
On top of all this, Stone is also offering his employees a bonus to get vaccinated.
I don't think it's our job to push people towards vaccination. I think we can promote it. So what we did as a little company was we offered to the staff a $100 bonus for the first jab and another $100 for the second jab.
And you didn't think that that was enough to have a vaccinated workforce?
Oh, definitely not. Our fear is that the only measure the government has is lockdown and vaccinations. I don't think that's good enough. I don't think lockdown is acceptable anymore.
A layered approach is key. Back at the University of Toronto, they're even testing wastewater for COVID in residences and have already identified 1 case. As for Choice Properties, rapid testing is offered at some of its buildings. There are at-home testing kits too, and the usual wipes. And employees also get higher-grade masks.
So even after we have the MERV 13 filters, we're actually filtering it again through another set of filters.
Back in the boiler room, a reminder of how much is at stake.
These are bag filters. So you're going through MERV 13, and now you're going through this set of filters. So you're actually double filtering the air.
Wow, that's a lot of filtration.
It is a lot of filtration. We are doing this because we need to do this.
Especially as more people go back indoors and go back to breathing in the same air. Joanna Rimmeliotis, CBC News, Toronto.